Welcome to A Shot in the Arm podcast, coming to you from Nairobi, Kenya and Brighton, UK. I'm Ben Plumley, here in Nairobi, and we are sharing the mic with Frontline AIDS to produce a new season of occasional podcasts to bridge the local and global on issues of critical importance to the global AIDS response. Podcasts that share the perspective of Frontline AIDS partners who work in more than 100 countries to support local, national and global community action on HIV, health and human rights. Well, in this episode, we're celebrating 30 years of Frontline AIDS. Established in 1994, it has truly been the frontline of the world's response to AIDS. What's unique about Frontline AIDS is that it has always been a partnership of organizations that are woven into their regional and local contexts, and so are best placed to define and achieve the joint mission to end AIDS for everyone, everywhere. While many international NGOs are currently working to develop a more localized model of development, working with grassroots organizations, this approach has been fundamental to Frontline AIDS DNA for over 30 years. So in this episode, we'll look at how Frontline AIDS and its partners implement programs and how these models have evolved over time. What does working in partnership and localization look like and mean in reality for the Frontline AIDS partnership? How is this different from the other operating models of many other NGOs? And what does it mean for Frontline AIDS partners who are truly on the front lines, not only of the AIDS response, but in Kenya and Ukraine? So I'm thrilled and honoured to introduce our guests today. First up, Dr. Lilian Otiso, the Executive Director of LVCT Health here in Nairobi, Kenya. Welcome back to A Shot in the Arm podcast, Lilian.
Thank you, Ben.
So we are coming at you from Nairobi at a very interesting time, aren't we? There have been a lot of political protests going on. How is everyone at LVCT Health, and what's your take on what's going on here?
All right, welcome, Ben, and interesting that you found yourself here as we exercised our democracy. And so we're happy to report that everyone at LVCT is safe. We are monitoring the situation. So far, we've been safe and looking forward to at least having some stability soon, but it's a day at a time.
Indeed it is. And as I think someone in the production team pointed out, every time I come to Nairobi, something happens. So our second guest, it's a real honor to welcome Andriy Klepikov, who is the Executive Director of Ukraine's Alliance for Public Health. We've had, Andriy, a number of your colleagues on the podcast in the past, but we haven't been able to get you, so it's a real honor to be sharing the mic with you. Are you worried a bit that perhaps Ukraine is not so much in the headlines, and how is everyone at the Alliance?
Yeah, first of all, happy to and honored to be here. Thank you. Now, time in Ukraine is not very stable because of the escalation of the war, but also, as you mentioned, attention to Ukraine globally is slowing down a bit. And not only in attention, but also international support and aid, including humanitarian assistance. So this is a very dangerous trend we need to oppose to.
Well, it's great to have you here, Andriy, and you have all of our support. And joining you in the Brighton studio is someone from Frontline AIDS I've been hoping to get onto the podcast for quite a while. It's David Clark, who is the head of programs of Frontline AIDS. David, welcome to the podcast.
Hi, Ben. Good to be here.
Now, you're an interesting one because you've had a career in development in the, let's say, the more traditional international NGO field. You've been at Frontline AIDS for a few years now. Can you tell me a bit about how this DNA in Frontline AIDS is so different when it comes to partnering with organizations around the world?
Sure. So I was reflecting the other day in kind of preparation for this. I was at an organization where we were preparing for the Grand Bargain back in 2015, 2016. So the world's kind of humanitarian organizations coming together to look at a number of things, but they made a promise there, very solemnly made by by a number of humanitarian leaders that they would strive towards 25% of humanitarian funding going direct to local organizations. Truth is, they've missed that target by some stretch now. I look back to the funding that this partnership was sitting on then, and you look back at 2016 figures, and somewhere in the region of 80% of the funding that the partnership held went directly to local organizations, raised and spent by them in their context with their leadership. And then, of course, there's an amount that was kind of running through the Secretariat as it was then, and now Frontline Global. So it's different. It feels different working in this kind of organization where you are engaging very, very directly with folk literally on the front line. And kind of there isn't really the kind of we play a different kind of intermediary role compared with other organizations I've worked in. That's for sure.
Do you know, it's funny because here we are celebrating 30 years, and I know this is going to seriously age me. Lilian, don't say anything. But I came to the opening of what was then called the HIV/AIDS Alliance in London in 1994, and I think into 1995. And you know what? It is so good to hear that the principles of partnership have not only remained constant, but have grown over the years, and as the organization flourished and became Frontline AIDS. Andriy, a question for you, because you too, with the Alliance for Public Health, have been with Frontline AIDS for a lot of this journey. How has the role of what were then linking organizations and are now partners, how has that evolved, and how has that strengthened mutually the global, based out of Brighton and South Africa, but also country organizations like your own?
Very good question. Yes, I'm also been with Frontline AIDS Alliance for 24 years now. I think my organization is actually a good example, which started from scratch with no office, no team, just several enthusiastic people, and with at that time Alliance or Frontline AIDS backup support. So it was rather initiative. And now our organization is one of the largest civil society organizations working in health in Ukraine and broader in Eastern Europe and Central Asia. This is quite illustrative how this community and civil society support brought results in strengthening civil society sector, given the stronger voice and much more. We observe in the partnership increasing of number of partners nearly twice in comparison with the previous model. So it's good development. Of course, connections are, level of connections are different with many organizations. It's not the same, and it shouldn't be the same, because part of the culture is the diversity, accepting and supporting diversity. But generally, we are nearly 60 organizations all over the world. So it's a very strong footprint, bringing voices from different continents and countries to consolidated advocacy or policy efforts, which we also very need in contemporary world.
Thanks, Andriy. Now, Lilian, you have a slightly different story of your relationship with Frontline AIDS. LVCT Health joined the partnership when?
So we joined the partnership in 2018, and we came in as a partner in one of the projects. So that linking organization model had shifted to more of partnership. But we came in terms of implementing a project, was called Pitch Project, which was very aligned with our strategy as an organization, where the idea is to build the capacity of smaller CBOs and other local NGOs to be able to deliver interventions on targeting the vulnerable and marginalized. And so for us, that whole, we joined the partnership deliberately because of that interest in building local organizations, local partnerships, and also just being able to access broader people who are involved in HIV advocacy, and of course, funding opportunities, because we were able to get funding through that.
I mean, a question, I guess, for both of you before coming on to David. Obviously, the partnership is about AIDS, Frontline AIDS, but for both of you, your work has expanded beyond that. And Andriy, for you, for the Alliance for Public Health, you've become one of the major backbones of health service delivery in a war-torn country through, your mobile clinics. How did that heritage prepare you for this terrible moment of crisis?
Exactly. Frontline is one of the two words describing our organization, Frontline AIDS. And being on the front line means being in a hot spot where the risk and problems are the highest. In AIDS response, but also in human rights, in defending human rights, in defending core principle of equality, and which allow us to work. What we learned since the beginning of the world is changing so quickly. So we learn how to be agile, dynamic. When 7 million of our population became internally displaced people, we couldn't be statical. So we shifted to these mobile services, we extended their work. And there are many things like shifting from traditional model to digital, even from traditional NGO work or community center to more outreach or telemedicine and online counseling. So many things have been changed, and many due to the war, to be relevant, to be up to the moment.
And Lilian, when I was with you last year, and check out our podcasts with Lilian in Nairobi, you were focusing a lot of your work on supporting and empowering young people, particularly teenage girls. And I've been fascinated at the range of partnerships that you yourself have built up, whether it's with different government departments, local governments, but also the faith communities. So you too have built a somewhat broader than HIV mission, right?
Right. And as an organization, we did start focusing on HIV and specifically HIV testing and counseling. But since then, we started looking at what are the needs of the vulnerable populations we serve. And so providing a holistic health package. And that means addressing health systems. It means addressing the community linkage with the facility, getting their voice heard, and getting to know the stakeholders that we need to work with. And that has really helped us to strengthen our partnerships, grow our work. So right now, as an institution, we do, besides HIV, it's a broader sexual reproductive health needs. Gender and gender-based violence have actually been quite big. There's also mental health, which is now a major issue, even in HIV and other programs. And our priority is to make sure that we integrate these services, because the HIV response has now gone to a place where it can't just be a siloed approach. It has to be integrated. And we've grown that, and through the partnership as well, even through the Frontline partnership that we are in teams that are able to look at how do we come up with innovations, how do we come up with new priorities. For example, we're doing a project on female genital schistosomiasis with Frontline AIDS, aimed at integrating it within HIV because it creates vulnerability for adolescent girls and young women and puts them at risk of HIV and also just SRH generally. And so for me, that's a priority in terms of how do we take forward partnerships and how do we make sure that we are equitable partnerships actually from the communities to other NGOs to government and donors.
So David, I guess I know this resonates a lot with you, both in terms of the institutional thinking, but your own thinking as well. And I guess the question for me is, talk of localization and decolonialization is cheap. It's very easy to talk the talk. Could you tell us a little bit about how Frontline AIDS has walked the walk?
So I think the first thing I'd say is you mentioned it at the beginning, the DNA, right? So from the very beginning, the whole principle of Frontline AIDS was around community action on HIV. So it was putting resources in the hands of communities as quickly as possible And it felt like, I wasn't there at the time, but from as I'm told by colleagues like Andriy, it felt like an emergency response. And it was about putting money in the hands of the communities, because the communities are where epidemics start and where they end. So from the beginning, it was about putting money in the hands of and resources in the hands of communities. Eventually, that progressed into money plus technical resources and kind of technical support. And all along, it wasn't about parachuting in experts from outside. It is about building on the local resources that are there. And when I hear these stories now about how APH has adapted to conflict, or how LVCT is thinking about integrating SRHR, HIV, and FGS, it reminds me of the heritage that was built up during that time. So to me, it's a huge investment that's gone on over years and years and years into local organizations by the wider HIV response as a whole. But I think the Frontline AIDS has always tried to stay a step ahead. So I joined, I'm in my 8th year now, but before I joined, I was looking from the outside and going, wow, that's something we've been thinking about, been doing, but not brave enough to do from the outside. And I think now we have to hold ourselves to an even higher standard. So yeah, it's great that we've got a lot of money sat in the under the leadership of national organizations. But what can we do further that really centers that experience much more strongly? We're doing things like for each of our strategy areas, we're having co-conveners from the partnership, where those co-conveners or conveners of the partnership are pulling together our collective experience around innovation, for example, and making sure that if an experience is had in one place in the partnership, that the wider partnership knows about it through webinars, through packaging up great content, and kind of making sure that learning flows like electricity through the partnership and beyond. So to me, that's like that we have to stay a step ahead. And I want to look back in 10 years' time from now and say, yeah, we were ahead of the curve on whatever's coming next.
So give us an example. What's a program, your head of programs, what's really grabbing your attention at the moment that brings in the leadership, the shared leadership of partners across the countries?
So one project that I would highlight is our partnership around testing and bringing to scale new technologies in harm reduction. So globally, less than 1% of the population of the world's population are accessing high quality harm reduction services, the WHO standard approved, and we have an opportunity to bring in new and underused technologies like long-acting opioid agonist therapy, like low dead space syringes into programs, and in new contexts, Nigeria, Kyrgyzstan, Egypt, all places with growing hepatitis and HIV epidemics amongst the population of people who use drugs. And we've pulled together a partnership really with expertise from the global to the local. So you've got an organization like DAPO in Nigeria, which is expert in mobilizing drug users and the drug using community in Nigeria, all the way through to the expertise of APH, which runs the world's largest civil society-led harm reduction program. And Andriy's just been to visit Nigeria, for example, to kind of share that experience, both practically, what's working, what's not working, but also kind of politically. There are certain lessons you learn about bringing in harm reduction programs in really, really restricted contexts. And for many years, the needle and syringe programming has been illegal in Nigeria, and there was years and years of kind of progressive lobbying to kind of change that. And when the opportunity came with a new hepatitis strategy for needle and syringe programming, really the partnership was mobilized to kind of step in and make sure that what was put in place leapfrogged and brought in the latest technology, brought in the latest thinking, and put it in the hands of communities. and that the communities themselves accepted that new way of working, and that they benefit from it, and actually they have a say in whether they're happy with how it's being done or not. So yeah, for me, that's a really exciting piece of work that stands in kind of 5 or 6 years of kind of lobbying and advocacy, to be in a place where we can kind of really influence what gets done on the ground. And organizations like APH are a huge technical partner in how do you procure, how do you do, so they're the ones running that, and they have significant kind of leadership in that program, all the way from Ukraine to Nigeria.
Let's stick with harm reduction just for a moment. And Andriy, the Alliance for Public Health was central in driving harm reduction across the country of Ukraine, but had particular success before, I think, 2014, in Crimea. And the first invasion of the Little Green Men brought an end to that very, very quickly. What I'm hearing from David is that we are always fighting for the same issues. We can't assume that we've guaranteed a rights-based approach. How have you been able to continue that passion within Ukraine during these last few years?
Of course, it's very important for any program, and for harm reduction particularly, to focus equally on technical expertise and share technical knowledge, but also ensure friendly policy environment or enabling environment. Because, as you said, our northern country invader Russia, they burn medications, like in Middle Ages, books were burned, in fire. So it's they stop opioid agonist treatment in a minute, so which is torture actually to the patient. So that's why protection of the gains from policy perspective in HIV and work with people who use drugs, programs for LGBTQI community is so critical for sustaining these programs. That's why it's important to balance programmatic and advocacy and policy work. And in regard to Ukrainian context, we see that during the war, people who were vulnerable before the war became much more vulnerable. People who use drugs is a very good example, because they moved, using drugs in unknown circumstances. And just one example, demand for naloxone, this is a medication for preventing overdose, increased 4 times during the war. 4 times. So that means the risk and cases of overdoses are dramatically increasing. So it's a signal how relevant our work is and how important to intensify it.
Lilian, as well as this sort of broader work with young people, you've also been working with key affected populations. And I don't know the extent to which what David and Andriy resonates with you as it relates to finding people where they are.
Yeah. It completely resonates, and has been one of the things LVCT is very strong doing is actually identifying or working with communities. And because we're a local organization, we know where the communities are, we know their needs, we know how to get to them, and how to get to those who are key and affected and are hidden. And so we do have a program for people who inject drugs. And one of those has been to go to the drug dens and identify them where the families have already given up on them, have neglected them, and get them into the program, get them cleaned up, and get them to have methadone, needle and syringe programs, but also economic empowerment as a key element to bring them back to society. And we've done that for a lot of vulnerable populations. And in addition to that, we have gone to the level where within affected communities, we're able to go deeper and see who is even more vulnerable. So, for example, if it is women who inject drugs, then we're able to identify them and work with them to come up with programs that work for them. And those are lessons that we've shared and we've learned from other partners, actually, from having all these partnerships. We know we can't do it alone. And we are also very deliberate to make sure that as funding now is reducing, there's talk of transition. I think we were talking earlier about transition of funding, for example, from PEPFAR. How do we have sustainable models with communities, with government taking up a lot more? And so we are learning and we really look forward to implementing that.
Just one final shout out to a Frontline AIDS partner, the former AIDS Care China, which of course I was affiliated with as a board member, was another one of these Frontline AIDS champions, and it reminds me Thomas Kai, the founder. There is something of Thomas in both you, Lilian, and you, Andriy, and so it's really interesting the kind of leaders who come out of Frontline AIDS. The other thing, sort of looking at the situation now, I wanted to touch on was human rights, because that has been a central part of also your DNA. And David, I wonder if you could just sort of talk about how you have incorporated human rights agendas into pretty much everything. You mentioned long-acting injectables for HIV prevention and treatment, how the Frontline AIDS approach to treatment is rooted in human rights.
Sure. So as you say, it's central to everything, which is easy to say and difficult to do. And I think there are a few examples I could give kind of right now, because I think rights is suddenly on everybody's lips. As we've got the kind of the rise of an anti-rights agenda, and we're looking across and seeing from targeting of LGBT populations, we're seeing anti-homosexuality bills, we're seeing the PEPFAR refunding being influenced by by an anti-rights opposition. So it's suddenly kind of people are realizing, I think, how central and how critical rights are. I guess there's a few tenets of a Frontline AIDS program as relates to human rights. One is to center the person first and foremost, center their experience. We don't necessarily talk about kind of hard to reach populations. They're underserved. Like, we need to think about switching the service to the person who's going to use it. A really clear example of that is our colleagues in Allied Medical Services in Uganda rethinking their operating model, because folk were frankly too scared to leave the house during the day. So thinking about how do they reoperate and receive folk later in the evening, sometimes at night. So that's for me, that's a really important human rights principle of kind of putting the person front and center. Then there's a few kind of more harder and kind of core human rights things that we need to do. One is that we need to provide tangible support when there are situations of crisis. And that's something that I'm incredibly proud of, that we've been part of, providing rapid response grants into community organizations very quickly. We've been doing that since 2016, and demand for that this year has grown because of that anti-rights opposition. The second thing is providing really high quality human rights monitoring and response tools. So our React tool that we developed again back in the mid 2010s, and again with contributions and real leadership from the partnership, particularly APH, is now operating in 20 countries plus. And we're seeing kind of demand for that, and kind of putting in place really strong mechanisms by which individuals can be received and receive high quality support. But critically, data on that is then produced, and it leads to the third thing, which is advocacy. And we need to find sensible, sensitive, intelligent ways of advocating around human rights that sometimes may be very out there, very, very visible. But more often than not, it's actually what you do in corridors and different circles of influence that actually saves lives. And I think we have really developed that kind of skill, And I think we have to keep developing it because, frankly, the rule book has changed in the last 2 or 3 years around the kind of human rights opposition. And we're going to need to find a new set of tools to counter that, those new tools in our work.
So let's shift gears a little bit then, shall we, and talk about the situation that we're in at the moment. All three of you have spoken about how the situation has dramatically changed over the last 10 years, not just in the overall AIDS response, but in your own national contexts. And I wonder if I could be, putting you all on the spot a little bit. We've had 30 years of Frontline AIDS. Well, what's going to happen in the next 5 years, the next 10 years? And we've still got this goal of ending AIDS as a public health threat by 2030. And I guess, how should I ask this question? Glass half full, what do we need to do to achieve it? And maybe glass half empty, what's the long-term agenda we have to start implementing now to make sure that we can indeed envisage the delivery of the Frontline AIDS mission of ending AIDS everywhere? And Lilian, I'm going to put you on the spot first. What's your sense?
Okay, just reflecting on how you started the question, and I was thinking about what's happened in Kenya this past week. We have Gen Z showing us that they can stand up, they can read, they can go and advocate for their rights. And so from where I sit, it's the same thing that we need to have. For the 30 years, we've had people who've been in the fight, and we now need to have new energy put into the fight to be able to continue. We need to have younger people, younger organizations coming up and really leading. And also the localization agenda, making it real, because the problem has shifted and our problems are real for any local organization, wherever you are. And so like in this case, we have to actualize it. And I thought David started and said that things did not work out. I think that should not be given up. We need to make it deliberate. And funding has to really go to local organizations that know and have a way to think about the response and may keep the advocacy noise going. So like for the partnership, we have to be very strategic on the advocacy. How do we keep HIV relevant, even as we look at resilience and what is changing across the world? And how do we bring in new partners, new advocates, and who are at the front line within the space itself in the local organizations? And so I see progress. I also see us moving back a bit because the reality is like funding is shifting. And so we also have to think differently. When there's less money on the table, what are we going to do about it? And how do we keep the conversation relevant to really try and achieve the best we can moving forward?
And Andriy, I mean, you are co-chair of the upcoming AIDS 2024 conference in Munich. And I guess this is a question you're going to be asked a lot there. So what's your sense of where we will be in 5 years? And how much longer do us old dinosaurs have to be supporting, perhaps not mentoring quite so much now, the next generation?
So let me start, as we have a half full glass on our table, to continue this analogy and to say, if you look from the bottom up, it might look like it's a full glass. So I think firstly we need to oppose these trends, dangerous trends that AIDS is over. It's a very dangerous perspective because in reality glass is just half full. So it's an illusion that it's nearly ended, nearly fully put. Secondly, if we look at the glass, it's actually people left behind at the moment. So from one side, there is a hope for better technological solution, cure, more effective treatment. But from another side, issue of access, of justice and equality is so critical because if tablets are invented and still on the shelf, it causes no effect. It should be reachable and accessible from people at the moment left from these services. And in this regard, issue of rights and eliminating any barriers is so critical addition to technological innovation. So next 5 years will be a test how successful we will be in elevating not only technology, which is also very important developments with long-acting, especially both PrEP and treatment, but also with rights and access and equality.
So, David, let me put the million-dollar question to you. Flatlining, perhaps even declining funding over the last period, how does the partnership, the Frontline AIDS partnership, advocate for renewed investments in the global AIDS response?
So, I mean, on the one hand, we're talking about a number of kind of overlapping threats. We've got declining funding and transitions that are being done in ways that potentially and actually exclude some of the populations that we care about and are central to our response. We're talking about a degradation of rights in those spaces. We're also looking at, another threat to bring into the mix is our declining and, frankly, abused ecology. And climate change will have a huge impact on the HIV response and the wider health systems, and we need to wake up to that. What gives me hope in this is a little bit like Lilian. It's the generation coming, because and I don't want to kind of put all the responsibility on young people. I think there needs to be some kind of intergenerational solidarity here, because I'm reading comments that from young people that say that 2030 goal, they see it as a promise. They said, you made a promise to us that it will be we will be the last generation that has this situation, and so for me, I kind of turn to those new voices that are coming in, and we just recently concluded the Ready Academy, or one of the latest iterations of the Ready Academy, that brings together, under the leadership of Y+, young people from across Africa. Wouldn't it be great if it were global? And asks them and kind of puts them in and supports their leadership. And some of the amazing things that are coming from them is they don't see the world in kind of HIV and everything else. They see HIV with. And so they're looking at climate change and they're seeing what are the opportunities to work together across these different silos and thinking differently about. We talked about FGS earlier. That isn't just a kind of an opportunity to access money, because there's money in neglected tropical disease and we kind of need to go over there. FGS, if you're a woman living with FGS, you're 3 times as likely to be also living with HIV. And so there's shared opportunity in this to kind of think in integrated ways and put the person at the center. So yes, you could be very easily kind of give in to pessimism, but as folks say in the climate movement, pessimism is a luxury we can't afford. And so we do need to be kind of, we need to come in with refreshed energy and recognizing that the answers that apply now are not the answers we're going to need in 5 years' time. So there's something about regenerating and kind of thinking what the next phase of our partnership looks like. I'm really excited to be gathering with the partners again in Munich and starting that conversation or restarting that conversation.
And let's not make promises that we can't keep, which is what makes me, always frustrates me about some of the international goals that we set ourselves. But as a sort of final area of conversation, and I guess this sort of brings it right back, partnership as part of your DNA. What does that look like in the next decade and beyond? And David, let me start with you. What is the global Frontline AIDS thinking about that? Where do you see it going?
I think we're clear it has to evolve. As Andriy said, one of the things that we talked about in the shift from the International HIV and AIDS Alliance to Frontline AIDS was this strapline of kind of join us, end it. We recognise that on our own, we won't make the difference that we need to make. And so we do need different alliances, different allegiances, and where we can kind of gather that kind of common agenda. So I think that is one part of it, thinking about how do we intersect with other silos, as it were, and kind of thinking about what our contribution is there with all of this amazing heritage that we bring as the HIV response. The other piece I think where we need to evolve is we have done a good job so far on making sure that partners are setting the agenda, that there is local voice in setting the agenda on what we should be working on. We need to go further on that. And there are I would say from Frontline AIDS, kind of from the global part of the partnership, we know that there are regions where we need to step up kind of engagement. Our MENA partners, the Middle East and North Africa partners, are facing a huge challenge at the moment in terms of HIV, and they're not being heard in some of the global spaces. So they were there at the PCB earlier this week, but we need to go kind of deeper on some of these areas of the partnership that haven't really had the light shone on them.
David, let me dive in, and it's one of the things we do in the HIV field. We love alphabet soups. You mentioned the PCB. What is it?
So PCB is the governing body of the UNAIDS, the joint UN body overlooking and overseeing the HIV response. We had folk in their governing body advocating for greater attention to the Middle East and North Africa region.
Brilliant. Lilian, the next 10 years, how do you see LVCT health growing, both in terms of, a strong national organization in Kenya, but how you begin to influence and drive the global agenda as a partner of Frontline AIDS?
Thank you, Ben. In our latest strategy, we've actually said that we are going beyond HIV, not meaning that we're leaving HIV, but the reality of is HIV and all these other emerging issues. There's broader health, climate change, and others. But more importantly, we also said we're going beyond borders. Our priority is we've learned a lot. We have a lot of experience. We just celebrated over 20 years of working and growing into a large local organization that is able to get and attract large amounts of funding and building other local organizations. So it is our belief that using our lessons, we can provide a lot of knowledge and share expertise and technical support to even other countries. And so our idea is, how do we now go in and partner with other like-minded organizations in other settings similar to ours, and we can be able to share those lessons so that we can all align and grow. And as part of that partnership, the way I see it is that we grow from more of like a hub or kind of a secretariat that we have with Frontline, which is good and has worked, but have more of a network, and that we have partnerships within partnerships, and we can be able to all grow. And regions that are similar, like we have our African region, there's MENA and the others. So our African region grows a strong partnership that is able to advocate for the needs of the region globally, address our advocacy needs, human rights, and even these aspects of transition and what does it mean, and our priorities. And so I see us really demonstrating leadership in that, and the partnership with Frontline AIDS is a good platform to help us start to do that, because we already arranged that way, but now it's to make them functional things.
It strikes me that both you, Lilian, and you, Andriy, are in countries that are truly on the front line of democracy, of human rights, and perhaps selfishly, Andriy, I would say that my hope for Ukraine is that, one, it becomes a full member of the European Union, and two, it becomes a full member of NATO within 10 years. But that apart, what do you see in terms of Alliance for Public Health and the Eastern European regional AIDS response?
Yeah, actually, my vision is very aligned actually what Lilian said. It's actually one of the opportunity Frontline AIDS created for us, for the partnership, to do horizontal sharing and learning. So, and it's very important because it's a true realization of this decolonization agenda. It means that we from Ukraine can provide equal or maybe even more important advice than provided from Western countries. Same with expertise from Kenya and other countries. So we evolved over the last 10 years from national organization to regional and now involved in truly international work. So I think this is also one of the key perspectives because especially in the context of reducing resources, it's opportunity to do it more effectively and to share response from more similar political and social contexts our countries in global south have. Second point, we didn't mention technological innovations and AI. I think it will be one of the key changing factor along with climate change and some geopolitical and peace and security agendas for the next 10 years. So it's also a perspective direction. I'm glad that it's also prioritized at the level of Frontline AIDS Global Plan of Action, innovations, including technological innovations, AI, and we work on exciting projects like virtual social worker or AI showing people with the highest risk to be tested, and some other things we are keen to share. And with the time, sharing becoming more global, more universal with the technology. So it's another direction. And finally, be agile, be prepared to deal with unknown things. Unfortunately, it's also our reality. We can plan, we can have big strategies and work plans, but reality is so volatile. So from us, from our experience, be prepared for crisis response, for humanitarian response, migration, move of the population, but also do integrated services because HIV is so interlinked with TB, with STI and hepatitis C. So we need to be addressing it holistically.
Thank you, Andriy. And I guess that's a call to action for all of us. And I'm conscious that we're getting to the top of the hour. And I just wonder to the three of you, is there anything we've missed? Is there anything additional to this really exciting agenda that you think our listeners and viewers really ought to know?
Maybe also we touched this, but didn't say it explicitly, that actually space for civil society and communities are shrinking. So we mentioned the punitive law getting approved in a number of countries, but it's actually moving from ad hoc cases to a very dangerous trend kind of with backup from very influential countries and political groups. It's clear in our region, Eastern Europe of Central Asia, how this front line is moving. And the battlefield is actually, in Ukraine we have battlefield, but in Eastern Europe and Central Asia, it's a battlefield between prejudice, stereotypes, ideology from one side, and evidence-based science from another side, human rights from another side. So this is another reality we have to take more seriously. So it's not just a context. This is a trend undermining not only HIV response, but our core principle and values we need to oppose with all possible efforts.
Yeah, I completely agree. And it sort of relates to what Lilian was saying earlier about this moment of transformation with the protests this week. Any last words, Lilian? Anything that we've missed?
Just a reminder that HIV is not over, although we like to think it is. And if we go backwards, then we'll set ourselves back, not just for HIV, but for a lot of other health conditions and health issues and the related factors. And so we need to sustain that whole conversation. The funding, I think it's sexy to say there's no funding or to reduce the funding, but actually it's a big threat to all of us, and we do need to be strategic. And we need countries, like in our case, to now start financing more, but also for the traditional donors not to just pull out. It is a process, it will take time, and we will not end HIV, or we'll still have a lot of people who still require treatment, who still require prevention services, and that investment needs to continue.
So, David, you get the last word, and anything you can do to be upbeat after the realistic comments from Andriy and Lilian, that would be deeply grateful.
Sure. So, I think when Andriy's touching on innovation, for me, that's a really exciting area and something I think we're sitting on a huge resource as a partnership. So we're reaching like 8 million people a year as a partnership. And there's so much experience coming from that. We talk about new injectables. We talk about new things being developed in laboratories in Geneva. Actually, the inspirational work that's been done, often at small scale, or that could be bigger, often in exploratory ways, but is being done across the partnership. We need to value that as much as we value the latest drug or the latest technology coming from Geneva. We need to center that experience. And when we do, we will realize that there are solutions in our hands already that we need to build on, that we need to invest in, and that we need to grow. And for me, that's true localization. That's really kind of valuing that local, that knowledge that's been generated in the heart of the problem by the people experiencing that problem. So to me, that's where I draw great inspiration. We pull it together every year in our innovation hub, and it's every year it continues to inspire me and say, yeah, there's an answer to climate change. There's an answer to how you operate in constrained settings. It's being done already. We just need to invest in it and grow it.
Well, what a great way, David, to wrap us up. Well, that's it for this episode. Happy 30th birthday, Frontline AIDS. Thanks to Lilian, Andriy and David. Now, you won't have noticed the technical troubles we faced getting this truly global podcast together. So a deep thanks to Nick Matuma and his team at Giraffe in Nairobi, to Tom Dalton at Brown Bear Studios in Brighton, to our production coordinator, Waisha Raphael in Johannesburg, South Africa, and of course to Erica Spera, our director and producer from Newsdoc Media in Sacramento, California. A huge shout out to Suzanne Fisher-Murray at Frontline AIDS. And finally, a huge thanks to you. Subscribe and give us 5 stars wherever you get your podcasts. Have a great week and a safe week, everyone.